Welcome back to the Health Elevated podcast, where we talk about all things in actionable health, how you can get the most out of the healthcare system in the United States. And we have a fun guest, Dr. Foles. I hope I'm pronouncing that right, Tim. Dr. Foles, who has a interesting background in clinical psychology and a number of other places as well, here to talk to us about all things. In fact, Dr. Foles, you talked earlier when we were discussing how people could potentially get the most out of their clinical relationships, their clinical decisions. So I wanted to ask you right off the bat, like, how do people get the most out of their interaction with the healthcare system as far as clinically speaking? Any thoughts on that?
Yeah, first of all, I'm glad to be here and feel free to call me Tim. And excited about what you guys are doing in this space. And I think there's a lot that people can do to get more out of the healthcare system. That includes thinking critically about their health, asking the right questions, seeking the right advice from the right experts, and basically being proactive. It's easy to put off healthcare, but that usually bites us in the long run.
Yeah,
Y- y-
it's crazy how much that our healthcare depends on what we're doing on the daily basis, and it really doesn't matter so much. Those doctor visits are very important, but at the end of the day, it seems to be much more about what we're doing in our daily lives, what we're eating, if we're exercising or not, and if we're taking care of our mental health. Any thoughts on that, Tim?
Yeah, those things are really important. And I think our society is shifting more towards valuing those things, but sometimes at a hidden cost. So, for example, if your social media feed is full of people who are telling you how you can optimize your sleep and your diet and your exercise and all those things, that could be good unless it creates this kind of hypervigilance and health anxiety that ends up actually hurting you. And I'll give you one example. There's some research showing that people who use wearables to monitor their sleep, which can be a good thing, you want to try to get a good, healthy amount and type of sleep. But there's this side effect of the wearables, which is people have this sleep anxiety. So their sleep can actually deteriorate because of the wearables. They go to sleep worried about, oh no, am I going to get enough sleep? Am I going to get enough deep sleep? What is my app going to say in the morning when I wake up? So I think it's all a balance, trying to find that right rhythm around how can I be proactive? How can I take care of these important pieces of my daily life that equate to health without going overboard and becoming health anxious?
That reminds me, when doing research, one of the many biases that can creep into any of the studies that they talk about is called the Hawthorne effect, if I'm remembering my terminology correctly, which basically says that when people know that they're being observed, they start to behave a little bit differently, which can impact the study that you're doing because you don't want to have people change their behavior when you're observing them. You want to like observe them without them knowing if possible. And so like that kinda comes into play with what you're saying with the smartwatches. People know that they're being observed, their sleep is being tracked, and so it impacts their behavior in a way that could be actually worse for them than if they weren't measuring it at all, so I find that quite fascinating. But speaking of that, all this kind of relates to what is called behavioral health, right? And I was wondering if you could define for us and the listeners what is behavioral health and why it is so important to our health in general.
Sure. So, behavioral health, sometimes called mental and behavioral health, a large domain with a lot of stuff in it. So, it includes everything from normal everyday behaviors. How am I exercising? How am I eating? How am I interacting with my family and friends? To more clinically serious issues that need professional treatment, like depression, anxiety, schizophrenia, obsessive compulsive disorder, etc. So it's a large bucket, but it's an important one.
Yeah, and how do you think that interacts with our health in the long term? So one thing that I've studied, and I study these things from a data science perspective, so I'm interested to hear your perspective on this, Tim, is how people are able to stick to their healthy behaviors long term. And so, what I was able to do is to do a work with a number of data sets of different healthy behaviors. Some of the ones you're talking about. So, the specific ones I looked at were like walking, taking medications, mindfulness meditation, and in those areas. And a few things that are quite obvious is that developing and sticking to healthy habits long term is very difficult. But also, on the same time, in the literature, that those who are able to create and stick to these healthy habits in the long term end up having better health outcomes. And so there seems to be behavioral health almost might be the key potentially to preventing some of these chronic diseases that are costing the healthcare consumers a lot of money, the healthcare system in general in the United States a lot of money. So, how do you think, Tim, that behavioral health interacts with chronic disease and long-term wellness and health?
It's huge, and it's really important to pay attention to that, but it's hard to disentangle sometimes. Oh, health is very closely integrated into all other aspects of health, including genetics. So, for example, things like diet and exercise really matter and are important to pay attention to, but they aren't a cure all, nor will they prevent everything. If you have certain genetic predispositions, then diet and exercise and other healthy behaviors can mitigate your risks or, in some cases, eliminate your risks. In other cases, they're still important, but you still have some extra work that you have to do. Take, for example, people with a high cholesterol. That's an important risk factor for all sorts of things, including cardiovascular disease and stroke. And you can do a lot to help your cholesterol with diet and exercise. But in some cases, it's not enough. You've got to take medication as well, which is an important part of prevention. And in fact, is a behavior in and of itself. Medication adherence and medication compliance is a part of healthy behaviors. There's other ways in which you can have this interaction. For example, if you have a family history of alcoholism, which does have some genetic component, then you can completely eliminate that risk by not drinking alcohol. In other cases, it's not so clear cut. But in all these things, it helps to learn all you can. This podcast is a great way to do that and take things one step at a time. This week or this month, I'm going to tackle this simple habit and work on it until I've got it down, and then I'm going to move on to the next. There's a power of kind of habit stacking like that that pays off big dividends in the long run.
Yeah, I
Yeah.
like how you framed it here because it's true that you can have the most perfect habits in your healthy behavior and potentially still see adverse health outcomes because you might be genetically set up to have said chronic disease, for example. Like, maybe I understand, and I'm not like an expert in this. I understand that certain cancers, for example, are you have much higher probability of obtaining those cancers if certain genetic markers are present. And so one way that I kind of like to think about this, I'm curious your thoughts on this, Tim, is we're playing a game of probabilities. And for a lot of us, we're all starting with different baselines of probabilities. We have different predispositions, we have different struggles, we have different internal things going on. Some of us have different body shapes, some of us are more prone to, like you said, alcoholism or obesity. And we're all starting with a different baseline of probabilities. But the one thing that seems to be the case is that these healthy behaviors, no matter where you're at in starting with those probabilities, you can decrease the probability of getting X chronic disease. And none of us are likely going to get those completely all to zero, at least on a macro scale. Like, just we're probably never going to completely avoid chronic disease 100%. But there is a large portion that is probably preventable that
Yes.
if we interact or we perform these healthy behaviors,
Years.
we
We
can,
can
at the very least, decrease the probability and therefore increase the probability of a healthier, high quality life as we age. What are your thoughts on that, Tim?
Yeah, definitely. And we are learning more and more that allows us to navigate that space wisely. For example, if you get screened, just your kind of typical screening that you get in a lot of primary care settings, you have actionable information about things like your liver function, your kidney function, cholesterol, your glucose, etc. And just getting that simple screening that almost all primary care practitioners will supply can have a huge difference if you do it early and often and you take action based on the results. Doesn't mean that you can change your genetics, but you can, like you're saying, mitigate a lot of potential risks of future disease. In addition, there are some disease conditions where even once you have the disease, you can do a lot to mitigate its effects on you just by managing it correctly with behavioral health. So, for example, people with type 1 diabetes who stay on top of their insulin and their glucose are much more functional. And likewise, people who have mental health conditions do some baseline behaviors like socializing, getting exercise, getting exposure to sunlight, doing things that stimulate reward system circuitry, like listening to good music. And those kind of things aren't going to cure your illness, need specialized treatment for that and sometimes medication, but they do go a long way to help stabilize. And once you're in remission, to prevent future episodes.
Yeah, it's crazy how much of healthcare is very much a trade-off game. You're supposed to go outside to get some sunlight, but you can't get too much because then you can increase your risk of skin cancer. It's one of the examples that come to mind. I find that kind of fascinating that like almost everything we eat has some kind of trade-off where it's you can't only eat that, you also gotta eat some other things too, so you gotta balance everything. And I think what's important for maybe our listeners here is that your individual health needs to come into play into the equation. You can't just there's not like a one solution for everyone. Like maybe and it depends on where you live, it depends on kind of your genetics of what maybe you need to focus on over what others need to focus on. And so the comparison game doesn't really work because some people might need to eat a certain way to get the best out of their body, follow a certain diet. Others, said diet might not work for them. Some people need to follow certain exercise regimens. Others might prefer other regimens. But at the end of the day, we all know diet, exercise, and trying all these other healthy behaviors, sleeping well, medication adherence. And so I find that very interesting. But one of the maybe biggest areas when people think of behavioral health, of course, is what you touched on, which is mental health, the mental health aspect of it. And what we're seeing, and I've seen this in the data, particularly in the Western United States, and I'm sure it's everywhere in the United States actually, is that since the COVID-19 pandemic, the rate of healthcare utilization in the realm of mental health has gone up tremendously. It's gone up a lot. And I wonder, why do you think that is, Tim? And is that a good thing or a bad thing?
Great question. Hard to answer that question conclusively, but there are a number of possibilities. One possibility is that we have greater awareness of our mental health and are seeking treatment because there's less stigma around mental health. And that could be a good thing. People who were suffering previously and didn't understand or acknowledge or seek treatment for it are now getting treatment. Another possibility is that we've actually deteriorated on a global level in terms of our mental health. And there's some pockets of information where that seems to be accurate. And changes in our society post COVID can contribute to that. For example, this is all over the news, but there is interesting evidence around the use of social media and mental illness. The studies of those show some pretty robust correlations. Causal evidences is a little trickier. There is some, for example, randomized trials that link social media use in adolescence to depression. However, it's mitigated to a certain extent by the adolescent's temperament and their kind of predisposition toward social comparison. If you're the kind of teenager that is more likely to do social comparison, social media is going to be rough. But some adolescents have been inoculated against that. That doesn't mean they're okay to use social media without any guardrails, but it does mean the situation is a little nuanced. That's just one example, but there's all sorts of kind of nuances around where mental illness may have increased post COVID, where it may have decreased, and how that might translate into greater healthcare utilization.
Yeah, that's interesting you bring up social
Social
media
media.
and fascinating what you were just saying there. My question that comes to mind is based on your experience and all your background, you mentioned that right now it's really hard to extract causality from the association of social media with depression, anxiety. But I wonder as we move forward and start to study that even further, number one, what is your hypothesis
As
about
how
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 social media may or may not be impacting mental health of everyone, including teens? And number two, if it is indeed the case that there is a causal link, what do you think should be done about that?
questions, tough answers. I can give my opinion, but I think it's going to take a lot of us working together to investigate, understand, and act on what research uncovers about social media. One thing I do think we know now already that's pretty clear, and that is use of social media alters our brain functioning. Now, that doesn't mean there's dramatic effects that can't be undone, but it means we have to treat social media not just as kind of benign pastime or hobby, but as something that needs to be carefully managed. If you were prescribed a medication from a physician, you would want to be confident that medication was safe and effective. There's very rigorous standards that go into how the FDA approves medication. We don't have anything like that for all sorts of social and behavioral things like social media. And if social media were a drug that were investigated the same way that our medications for other healthcare conditions are, social media might be considered very potentially dangerous drug. Now, that analogy has some nuances to it. It can also be very beneficial in terms of connecting with people, but it isn't a substitute for what we know about real social interactions and their positive effect on health. So social media can be dangerous based on, how the kind of doom scrolling activates dopaminergic circuitry. It can be dangerous in how it substitutes for regular social interaction or substitutes for simply quiet mind time. A lot of people, if they have a few minutes of downtime in between meetings or other obligations, they immediately whip out their phone and start scrolling. Absent that, you might take a minute to look out the window or to meditate or to talk to a friend or a neighbor or a coworker. So the replacement factor is huge. And then last, like I mentioned already, there's the social comparison, which activates a lot of potential circuitry around self-image and around and that can lead to mental illness. And there is some evidence of that.
Fascinating. And you have, as the rise of need for mental health care, you've also seen the economics here as the demand for care has increased. You're also seeing the supply of people providing mental health care increase in the form of people who are offering wellness coaching, these gurus, these trauma counselors, some of which have like official, certifications. Others are just like these wellness coaches, which kind of is a an umbrella term that allows people to just give advice to other people. So I wonder, from your expertise, Tim, is it a good thing that the demand is being met? Or is it a bad thing that we're seeing it met in a way that's not as rigorous as maybe your field of study or your colleagues' fields of study has been? What are your thoughts on that?
It's such a good question. I think we have a huge problem with increasing, like you said, increasing rates of mental illness in some areas and difficulty for people accessing qualified professionals, licensed mental behavioral health practitioners. So there's definitely a need, and I don't think we have the supply to meet that need at present with licensed practitioners. There are important cautions about getting help from, like you said, these paraprofessionals, wellness counselors, and lifestyle coaches. There are some out there who I think are doing good work and helping people, but they're never a substitute for a licensed clinician making a accurate diagnosis and giving you treatment recommendations, especially in the case of mental illness. And I think that may be where the line is. If you have a clinical diagnosis or think you might, then you want to get in to see a licensed clinician. If you want help to live a healthier life, but you don't have any diagnosable conditions, you're not really worried about that, then I think you could benefit from a wellness coach. The thing I would say to your audience that's important is that they should clearly understand the difference. And I think both are valuable, but they have their place, and you don't want to mix them up.
Sorry. Excellent. Thank you for that. And to wrap up here, I want to give you the floor, Tim. If you had 1 minute to share some actionable advice for our listeners where they can hopefully take what you're saying and turn it into something that can help them improve their health just by a marginal 1%, what would you say to them? And what is your advice that you have for our listeners?
I don't know if you get the stopwatch going, but I'll do my best. In 1 minute, I think the advice I would give is evidence really matters. We are blessed with a wealth of scientific information and scientific methods that have improved decade over decade. We should make use of that evidence. Sometimes it's hard to tease apart, and you can't get a real accurate understanding from a soundbite or from an AI bot or from a TikTok video. Instead, you need to trust experts when it comes to scientific information. That means asking the right questions. That means consulting with professionals, especially when it comes to your healthcare. And you can get second opinions. That's two experts. That's even better than one. But it's always better to trust an expert who knows the evidence, who understands how to evaluate the evidence, than to trust your friend or your neighbor or the internet.
Excellent. That is Dr. Tim Foles. Great guy, lots of awesome insight. Thank you so much for tuning in. If you're willing, give us a comment or a review. We'd love a 5-star review. And make sure you subscribe or follow so that you don't miss any future episodes of the Health Elevated podcast.